All right, Michael Browning here again. This is the next lesson, I think the third one in our series on motivation, how to get the best out of therapy. And today we're going to talk a bit like what happens in a therapy session, okay? How a session works. So when you're in a session, depends on the therapist. There's all kinds of different styles, but at the Whitestone Clinic, we tend to use what's called the GRUNTS method, okay? This is just something I took out of a number of other approaches, and I find it the best way to structure a therapy session. What it does is it creates such a structure that it's still lots of free-flowing in between, but the structure allows to kind of have a sense of the progress of the session and allows them to know what's next. And that's a very comforting thing for the client to kind of come in, know what's first, know what's next, know what's last, and then they know where they are in the therapy process. Because a lot of therapy is a lot of talking, and it could really feel like you're just doing circles, right? But if you kind of have that sense of structure, you're guided all the way through that therapy hour. So the GRUNTS method, it's an acronym. It stands for the greeting. So, we start off, it might be, how'd you get, what was it like in the office today? What's the weather like? It could be the typical small talk. We shouldn't spend a lot of time on that, like a minute or two. Some of the faith-based clients will start off with a prayer, but the point is it's just getting things started, right? Whatever that is. And then quickly we move into, therapists will ask, like, what do you recall from the last session? Now, the reason for this question, it's an old kind of teaching technique, but because we're going to probably enter into new material this session, we need to review what we had before. Obviously, that doesn't apply to your first session, but from the second session on, there'll be a little bit of review. It's not a test, you don't pass or fail this. You're probably not going to remember a lot of it, but it's what stood out for you, and it helps the therapist know what is most sticking with you, like what you felt was most pertinent. And that tells us a bit more about you, right? So every session you kind of start off after the greeting, you're going to go into the review of the last session. Sometimes the therapist will add a few of their notes, we also did this, we did that, just to kind of refresh things. And as a teaching method, it's sort of like opening the file and you're putting the next paper in the same file folder, right? Instead of being all random papers all over the place. But after the quick review, because we don't want to spend the whole session talking about the last session, we kind of go into updates. Updates is what you tell the therapist about the goings on, what's happened since the last session. This is not what you do like you would with a friend over coffee. It has to be pertinent to your therapy purpose, right? And I been caught aware of the thing we talked about last time. I had a situation that reflected that. I tried to remember what we talked about. I tried to apply a different behavior into that situation, or I had a task, to complete homework, and this is what I did on it. It worked, didn't work. I avoided it, whatever, right? So whatever updates. If they're big life events, met someone new, got a new job, lost a job, or whatever, right? If it's some big life event, you obviously want to let the therapist know in the updates. And then we know the context where you're coming in today, right? Maybe you're particularly distraught that day, okay? It's going to be hard to do certain kind of work, so we need to take care of where you're coming from that day. And if you're really doing well, we can dive deep into the next step, the thing that we have planned. So you need to give good updates to your therapist. But again, don't spend most of the session on that because, you're not paying for therapy to talk to a friend, okay, to tell you about what's going on in your life. You're asking for assistance to find growth and healing, okay? So after the updates, which kind of puts us into the current situation, the context, we get into new business. That's the N. And new business is what the therapy plan has for that session. Now, you might come with a very specific item you want to talk about, and depending on your therapy plan, it could very well fit. Then we would go into that. But if you're on a specific modular program, there might be a topic we have to make sure we cover today, and the therapist will lead you into that discussion as well. So new business is the meat of the sandwich here. The other stuff is like bread, lettuce, tomato, and then here's the meat, right? And so we're going to spend most of the session working on the new business. And depending on the therapeutic approach, it can take all kinds of angles. It could be doing certain exercises, EMDR type stuff. It could be doing certain breathing exercises. It could be doing CBT tools and thought beliefs and all that stuff. So it depends what the therapist has in plan for you that session, or what your needs are that session. But we'll spend most of the therapy on the new business. Now, nearer the end of that time, you get your sort of mustard, ketchup, mayo, whatever layer, and then of course the final, like the bottom piece of the sandwich. So if you look at that stage, is after new business, is tasks. Tasks are like intersessional assignments, homework. So you're going to be sort of, the therapist will say, so take this tool we just did today and practice it every day this week. Or in a scenario of such and such happening, attempt this different behavior, right? Or do journaling or do whatever. Like, the point of it is, like, there's going to be some kind of work that you need to do between now and the next session. So that's the tasks level. And it only takes a couple of minutes, a minute at most in many cases, to describe this is what you need to do. And then at the end, the very end, this is how you know it's the end of the session. The therapist is asking you, what did you get from today's session, right? What's your take home, your takeaway, whatever, grab bag, whatever they use. And what they're just saying is, give me a summary. Now, the reason for the summary, the therapist writes their own summary, right? But the reason we ask you for the summary is it helps us get a sense of what you experienced in the therapy session, what seemed most relevant to you. That might surprise us sometimes. It does me. Like, I'm thinking, well, we're focused on this. This is the main point. Wow, that was a really good point that came up. And then you just bring something up out of left field. But what it teaches us as a therapist is that's what you're looking for, right? And that's what you're hanging on to. So we help to bring that into the next sessions. We realize that's something more relevant to you and helps guide a little bit how we do some of the sessions. So your summary matters a lot. Another thing it might do is, because sometimes you talk a lot in therapy and go, what did I get out of that? But when you have to sit for a minute and think, okay, we covered this, we covered that, this is what I'm taking home with me, it actually kind of drills it in deeper. It helps you keep it. And that's a really important part of the therapy process. So, you have an idea how a good therapy session could run with a good structure, a lot of fluid openness in the middle part, because a lot can be done there. But the structure is what it is. I hope you have that mindset when you're coming in, not to the first session, but definitely from the second session on. Now, a couple things I'll point out is your pre-session prep is important. So, just as I talked about the earlier talk, you got to come to your first session with some ideas of what to share and with the therapist. The second session on, you want to make sure you reviewed some notes. So if you're taking notes during therapy or immediately after therapy, that's a really good idea, because when it's most freshest, you're gonna remember more. If you wait days or a week before writing your notes, you're not going to remember very much. So it's okay to take notes during the therapy session. It's okay to certainly spend time on your notebook after a therapy session, but review those before you come into your next session. Like, actually put into your schedule a time to prep for the session. So if you're trying to rush to an appointment and like you just get there, you're 5 minutes late, you haven't looked at anything, it's going to take a good chunk of time with therapy just to get you grounded and ready and all that stuff. And there's a bunch of stuff you're going to miss. So when you put your therapy schedule, like you have the time and appointment in your calendar, give yourself a margin of time before the session so you could arrive early or get set up early if it's online, and review the notes. Okay, get them fresh to you. It'll make it easier to answer the first part after the greeting, right? The review of last session, but it also gets your mindset in the right gear. Okay, it's like if you go to the gym and you didn't pack anything in your bag, you don't have gym clothes. I remember one time going to the gym in my dress shoes, it's not good planning. You're not going to get the best workout, right? So you kind of need to have a little bit of prep time scheduled in right before your session. And like if you're commuting or make the plan so you leave on time and give yourself enough margin to prep for the session. Don't just try to land right at the start of a session. That's important. Also be able to look at when you're going through things in the week, like look at yourself with a little bit of note taking. Try not to just remember it. Like, oh, I just came back from that party. I broke the ice in a conversation with somebody because I'm trying to be more assertive or less shy or whatever, right? And I make notes after. This is how I did. I attempted this. I attempted that. This is what I said or didn't say. Like, make some notes during your week, and that'll make it easier as you come to therapy. So you're not just like generally trying to catch some memory. You have something that'll spark that memory much more clearly. Okay. And of course, like I said before, take notes during the therapy session. It's perfectly fine to do so. Don't forget to write down your tasks as well. I've had a lot of clients, like they agreed to the task and so on, but they didn't write it down. And then they're partway through the week, like, oh, what the therapist asked me to do? I don't remember, So it's a pretty good idea to write them down, right in the therapy session or at least right after. But even if it's just sitting in your car, before you drive anywhere, write stuff down. Like, try to give yourself a margin on the other side of therapy so you don't have to like rush to the next appointment and you have no time to like absorb what you just spent all this money on to do your therapy with, right? So in the homework, I think you're basically looking at putting in these times in your calendars, making sure you have a notebook, making sure that you're clear about the prep time and the post time in your therapy session, and I think that you'll be very successful with that. I look forward to seeing you at the next lesson.